Dear students, today we are going to study about estrogens. In this session, we will study about their secretion in our body, their classification, and their uses. So, let us start. Estrogens are the hormones. These are the hormones secreted by ovaries in our body. Besides ovaries, they are also secreted by placenta, adrenals, and testes. Major portion of this hormone is secreted by the ovaries. Major portion is secreted by ovaries. In ovaries, they are secreted by the follicular cells. Follicular cells are those cells which develop into ovum in its adult stage. Ovum is the egg cell in humans. So this developing follicle ovum secretes this hormone. Means developing follicle, developing ovum secretes estrogens. So this was about the secretion of estrogens. Now we will study about their classification. Classification of estrogens. In general, we have classified estrogens into three main categories. Number first is the natural estrogens. Natural estrogen. In natural estrogens, we have estradiol. Estradiol. Next is estrone and estriol. These are the examples of natural estrogens, like that it is estradiol, estrone, and estriol. Next group of this hormone is semi-synthetic estrogens. Semi-synthetic estrogens. In this category, we have ethinyl estradiol. Ethinyl estradiol. Next, we have synthetic estrogens. Synthetic estrogens. In this category, we have stilbestrol. Stilbestrol, mestranol. Mestranol, hexaestrol. Hexaestrol, chlorotrinosine. Chlorotrinosine and dinestrol. Dinestrol. These are the synthetic estrogens and come under the group of synthetic estrogens. Now regulation of its synthesis. Estrogen secretion is regulated by hypothalamus. Hypothalamus is the region of the forebrain which coordinates both autonomic nervous system and anterior pituitary, activity of pituitary hormones. So, hypothalamus secretes gonadotropin releasing hormone. Gonadotropin releasing hormone. This hormone activates pituitary gland. Pituitary gland to secrete its hormones like FSH and LH. FSH is the follicle stimulating hormone and LH is the luteinizing hormone. Both these hormones are secreted by pituitary. These hormones in turn stimulate ovaries to secrete estrogens. So, ovaries secrete estrogen under the stimulation of FSH and LH. FSH and LH is stimulated in turn by the secretion of gonadotropin releasing hormone. This was about the regulation of their secretion. Now we will study about its actions in our body. Actions of estrogens. Actions of estrogens. Estrogens, number first, it helps us in the growth and development of vagina, uterus, fallopian tubes, and secondary sex characters. Secondary sex character means estrogens are very essential for the growth and the development of vagina, uterus, fallopian tube and secondary sex characters. Next action is it causes development of endometrium lining. Endometrium lining is the inner lining of the uterus. Endometrium lining. Next action is it maintains a normal structure of skin in females. Means the suppleness of the female skin is due to the estrogens. Number 4, it inhibits the resorption of bone. It inhibits resorption of bone. By resorption of bone, we mean transfer of calcium from bone to blood. Means estrogen reduces this activity. Means it reduces the transfer of calcium from bone to blood. Means it decreases the resorption of bone. Next action of this is fifth action. It decreases plasma LDL. By LDL we mean low density lipoprotein. This low density lipoprotein increases the risk of heart disease and stroke, because this low density lipoprotein gets stuck to the inner walls of the blood vessels, which can lead to the heart disease and stroke. These estrogens decrease this plasma low density lipoprotein, and this type of cholesterol is also sometimes known as bad cholesterol. So cholesterol. So it helps us to reduce the bad cholesterol level in our plasma. At the same time, it increases high density lipoprotein. It increases high density lipoprotein. These are the actions of the estrogens. Now coming to the adverse effects of estrogens. Adverse effects. Adverse effects include nausea, vomiting, headache, hypertension. Besides, these are also teratogenic. Teratogenic means when given to a pregnant lady, it causes defect in their child. In female child, it causes risk of vaginal and cervical cancer. So this was about the adverse effects of the estrogens. For further details, we will continue in next session. Thank you.